Hi there, I'm Dr. Bridget Norton. You can call me Bridget. This is Menopause Bites, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, we're diving into perimenopause, what it is and what you can expect. Let's get down to basics. Perimenopause literally means around menopause. We now call it menopause transition, and this is typically the period of time that's about 8 to 10 years before your final period, and it continues until 1 year after your final period, which marks the official onset of menopause. What is actually happening in perimenopause is that our ovaries are running out of eggs, and that might mean that you don't release an egg every month. That leads to those erratic periods and less fertility, but do not make the mistake of thinking you cannot get pregnant. Perimenopause is actually one of the most common times to have an unplanned pregnancy, and the risk of miscarriage is higher too. So, if you do not want to get pregnant, we recommend birth control until you are officially menopausal. The fact that your ovaries are not releasing eggs every month leads to fluctuating hormone levels, and those fluctuating hormones can lead to those symptoms that we most often associate with perimenopause. Just so you know, it is estrogen and progesterone levels that are fluctuating, not testosterone levels. Testosterone levels have actually been in decline since your early 20s. The perimenopause journey for each one of you is going to be very different. Some of you may sail through it with regular periods and no hot flashes and night sweats at all, but for the majority of us, unfortunately, it is not that easy. I always say that menopause is when the ovaries are wrung dry, and perimenopause is when the ovaries are sputtering. What do sputtering ovaries actually feel like to us? Well, this is the time frame when women start coming in complaining of lots of different issues that are impacting their day-to-day quality of life. Things like erratic periods and hot flashes and night sweats are probably some of the most common complaints we get. But there are other concerns too. Women come in complaining of weight gain, mood and sleep issues, brain fog, joint pain, hair loss, to name a few. But again, everyone is different, and not everyone is going to experience all of these issues or all of the time. So let's actually get a little bit more specific about periods and hot flashes in perimenopause. Period changes are very typical. Classically, periods are less reliable and less regular in the perimenopause. Although, interestingly, if you have polycystic ovarian syndrome or PCOS, you may actually have regular cycles for the first time in your life. We are taught in medical school that in the perimenopause, periods get close together and then they start skipping apart. And once you're skipping periods every 2 months or so, your final period is about 3 to 4 years away. Not very specific, I know, and not everyone follows what the textbook says. However, and this is really important, even if your periods are less reliable and less regular, they should still feel like your period, lasting about the same length of time that they normally do, with the same amount of bleeding. Prolonged heavy bleeding that is new or spotting and staining is not a perimenopausal period. Rather, we consider this abnormal uterine bleeding, and you should get that checked out to make sure there's nothing more serious going on. Hot flashes and night sweats are a classic perimenopausal and menopausal symptom. The official term for those are vasomotor symptoms. They come from the level of the brain, and about 60 to 80% of all women have them, and they last for an average of about 8 years. But unfortunately, that's the average. That means that some of you might not have them at all, and some of you might have them last for more than 20 years. Black women tend to have vasomotor symptoms that last longer than 10 years. And if your hot flashes and night sweats start early, before you're 45, for instance, it usually means that they will last longer than 10 years as well. The usual culprits make hot flashes and night sweats worse: tobacco, alcohol, and caffeine. But a history of depression and anxiety can mean you have more severe vasomotor symptoms too. Hot flashes and night sweats can also be very variable in the perimenopause, meaning that they can come and go. And they don't just stop once you're officially menopausal. We don't actually know when they will stop, which is annoying. As I mentioned, women come in reporting many other issues during this time frame, like mood and sleeping issues, brain fog, weight gain, and so on. These are all complicated, and while we love to blame perimenopause for everything, our fluctuating hormones may not be the sole culprit or the culprit at all. So it's a good time to come in and get a checkup and some basic blood work done, like a thyroid test, a diabetes screen, and a CBC, to make sure that we're not missing anything. But no hormone testing. Hormone testing is usually not helpful at all in the perimenopause, and we will talk about that in another episode. So that's it for another episode of Menopause Bites. Here are some takeaway bites to remember. Perimenopause is sputtering ovaries with erratic egg release and sputtering hormones that lead to many of the perimenopausal symptoms that we think about. Perimenopause usually starts 8 to 10 years before our final period and lasts for 1 year after our final period, and it's different for everyone. But most women in their 40s are perimenopausal or close to it. Spotting and staining or longer and heavier periods are not perimenopausal periods, but rather abnormal bleeding, and you should get that checked out. Until next time, may your hot flashes be bearable, your nights be restful, and your brain fog minimal.